We are live on YouTube. I am starting the recording. This is Ranjit Sahu, Marketing Head with Walter Bushnell. Welcome you all to this webinar of Indian Menopause Society in association with IMS Education Committee presents 10th live webinar on the very beautiful theme, that is sexuality in midlife and beyond. We have with us the eminent panelists across nations for this beautiful topic. With this, I hand over the session to Trishala ma'am to take it forward. Over to you, Trishala ma'am. It's all yours.
Yeah. Thank you, Mr. Ranjit. And hello. Yeah, ma'am, I'm audible.
Yes.
Thank you, Mr. Ranjit. And to start,
सबको म्यूट करो.
Hi Ragini.
हाँ त्रिशला बोलो.
To start with, at this outset, the day is passing by, and no matter how you have spent your entire day, but what matters more is to look at the beauty of setting sun, which makes everything serene around us. That's why it compels to acknowledge what God gives and forgives. And what man does, man only gets, and he forgets. With this, a very warm good evening to one and all from me, Dr. Sexuality, a practicing gynecologist in Nagpur. I am very much obliged to the organizers of the Indian Menopause Society, the President ma'am, Dr. Ambuja ma'am, General Secretary of IMS, Dr. Sudha ma'am, Education Committee Chairperson of IMS, Dr. Lakshmi Shekhande ma'am, for giving me such an opportunity for moderating a very prestigious ceremony on a very lucid as well the most catchy but a complex topic with theme sexuality in midlife and beyond. To read out today's theme topic itself, it puts a smile on face and helps us to bounce in our steps. Really, in true sense, it makes everyone to look younger. And for this, I am proceeding to introduce and invite none other than the ever youth looking, a pleasant persona to whom I always look her ahead of all, a well-known designer and a drafter of such daring and catchy topics in national webinars. Ma'am, you are the chairperson of Indian Menopause Society Educational Committee, a chairperson elect for ICOG. You are a national corresponding editor for the Journal of OBGY. You have delivered not less than 11 auditions and the 450 guest lectures in your credit. Hats off to you, ma'am. You are a Nagpur Ratna awardee as well. You are the Bharat Excellence awardee for the women's health. And इस मैडम के लिए मैडम ने पहले ही मुझे एहतियात बरत दी थी कि आप 2 शब्द कहेंगे. बस 2 शब्द कह के इनका इंट्रोडक्शन में पूरा करती हूँ कि लक्ष्मी मैम के लिए अगर कुछ भी कहना है तो सूरज को रोशनी दिखाने समान है. They are holding a ray of hope with a torch, and madam will now I invite madam on this forum to welcome everyone. Thank you, ma'am.
Thank you, dear Trishla, for such kind introduction. Very good evening to one and all. I would like to welcome our chief guest, National President, Dr. Ambuja Madam. As usual, I was discussing with her, ki Madam, what should be the topic this time? And we deliberated, and then we thought sexuality in midlife. But then I said, nahi madam, midlife to everyone will say 40s and 50s, let us add and beyond. Because the moment we add beyond, how many of us are really comfortable when we see a lady of 60 years? Do we really inquire about her sexual health? I mean, for her, it's a taboo. I mean, she's not speaking out. But as a healthcare provider, aren't we also prejudiced? Somewhere we are also lacking in our training to take care of her sexual health at that point of time. And that is why Madam and me, we decided that let us have a focused webinar on sexuality in midlife and beyond. And I'm so happy that I got the consent from two eminent subject experts. I know Ragini, you are also very passionate about the topic. And what to say about Dr. Padmini? She practices whole and soul only sexology practice. So she is the best person to guide us, we all participants, about this very, very sensitive topic of sexuality in midlife and beyond. So I welcome our Secretary General, Dr. Sudha Madam, both the eminent subject experts, Dr. Ragini Agarwal, Dr. Padmini Prasad, and my eminent chairpersons, Dr. Amrita, Dr. Reshmi. And of course, Trishla, how can I forget you? You are my dear friend. I also welcome all the esteemed audience who have logged in to update themselves about this very, very vital and important topic, which should be dealt in a very sensitive way at that phase of woman's life. So once again, welcome you all, and I hand over back to Trishla for further proceedings.
Thank you, Dr. Lakshmi Shekhande ma'am, for welcoming all on today's webinar. And I said in your introduction, you are the designer, you are the crafter of the such caring and sharing matters in midlife. So I thank you for welcoming everyone on this webinar, which will be of the great help for the normal people to get self-help education. And when we talk for any of the education here, an educated person comes as a rescuer, but who was a good judge, who had a good judgment and ability to think clearly and independently. That's why that the person knows how to learn and make others to learn. So here I welcoming none other than our President of Indian Menopause Society, Dr. Ambuja ma'am. Ambuja, sorry ma'am, Churanur, yes ma'am. Yes, you are the All India Vice President of Family Planning Association. You are the President of FPI Hyderabad.
Trishala, no, don't need to read so much. We will.
Okay, ma'am. Okay, ma'am. You are the.
Thank you.
You are the.
Yeah, you are the, from the experts a lot.
You are the
introduction
examiner. I welcome you, ma'am, over this platform.
Thank you for the introduction, Trishula. And there is some problem with my internet, so I will put off the video and
no,
I will.
You are audible. I mean, it's clear.
Yeah, audible. That's what I will put it. And good evening to everybody. I welcome everybody, including me, for this important topic. Because, as Lakshmi said, we discussed and discussed. Finally, we thought this is a good program. I really appreciate Lakshmi and Ragini for taking up topics of such an interesting and doing justice to their chairpersonship. Every month, without fail, each of you are doing. Of course, Ragini is doing much more in combination with other societies. That's a different. But Lakshmi is doing exclusively for Indian Menopause Society. And congratulations to you. And today's drawings really, Padmini Prasad want to tell about it. If anybody wants to say who is the prominent name in India about the sexual, dealing with the sexual problems, it is the first name comes as the Padmini. So it's nice to see you, Padmini and Ragini and all other my friends, Sudha, Amrita, the Reshmi and all. Very nice to see you all, because this COVID is not leaving us and we are not able to meet physically anywhere, and all the programs are getting cancelled. To talk about the sexuality, what we discussed, Lakshmi, last time and all, it is not midlife. We thought it is beyond. And any time when we are standing on the stage and talking about the sexuality, it is fine, it is good. But in the real life, what is happening? Though sex life is important for satisfying relationship, that's what is the slogan always we talk. But in real life, what is happening? When it comes to the level of 40 years and beyond, so many problems to the housewife. The stress at work, if she's a working lady like us, stress at workplace, stress at home, stress of children, stress of husband, so many stresses. And even for men, added to that are the chronic diseases like hypertension, diabetes and all. First comes is the erectile dysfunction. Even if the wife wants also, it's not possible. So this is a common problem everywhere. It is so rampant, even at a middle age, reproductive age group also, even if 30 years of age, because of these IT professions and all who work for 16 hours a day, they don't have sex even once a week. That weekends also, they will spend in social gatherings and going to pubs, clubs and all, drinking. Actually, drinking reduces the sexual desire. This is what is happening, and we don't know really where we are right now. And second thing is, the country like ours, we being little higher strata of society, we are talking about the sex, but it is a taboo always to talk about sex in our, especially in the rural areas, people, they don't talk. After the productive age, after the children are born, they feel that everything is over, they should not live together. That's what is the thing usually happens. And especially the hysterectomies are so rampant. When I was in Karnool, I was surprised to hear when they come for checkup, even after 6 months, even after giving instructions also, they will not have any sex at all. They say one thing is they are afraid of doing the sex, thinking that something will happen. And second is, oh, Bapre, why I should have the sex? I have my children, I have everything. Where is the need for the sex? That's what is the answer they used to give. So it is for the healthy life of a female. The sex is very important. That I don't know how many centuries it takes to inculcate that into the minds of our women, we should see. But anyhow, nothing wrong. We should go on talking and giving the knowledge to them. Even many people, they don't come out and speak about their sex life with the doctors also. Forget about talking with the family members, even with the doctors. So this is what we should learn. We are going to learn a lot from our experts, Dr. Ragini and Dr. Padmini. So thank you very much, Lakshmi, for selecting such a good topic and inviting us to participate today. Thank you very much. I hand over the mic to Sudha.
Trishla, first
Trishla, yeah, introduction. Because Sudha is known to everybody.
Yeah. But even two lines. And thank you, Ambuja madam. You are always, you have given free hand to be all chairpersons so that we can come out with these novel ideas, and you always agree with whatever suggestions or ideas we have. So thanks a lot.
Yeah, Lakshmi, we are all together.
Yeah.
See, that is why I will tell you, after Corona, what we have seen, many new ideas have come. Yes. Really, we never expected all those things. I always feel so much of good material is coming out. So many discussions are coming. Really, it is good. We should take suggestions from everybody, Then only we'll get the good ideas.
Thanks a lot.
Yeah, Trishla.
Yeah, thanks a lot, Anbuja ma'am, for your encouraging address as well the ability to communicate with all the entire fraternity as well with the delegates. Such ability with the clear thoughts and the ideas makes a person reasonable to accept and distinguish between the relevant and the trivial information, which ultimately helps the society with the productive use of knowledge whenever they need for. And in such a need of crisis in midlife and beyond, we are blessed to have our own today's guest of honor, who is the Secretary General of Indian Menopause Society. Ma'am, you are the Managing Committee member of PCO, founder, President of Jammu Menopause Society, Editor-in-Chief, and
Thank
many other.
you.
Yeah, and with this endless list of feathers in your cap, you are a unique persona with the positive aura. Professor Sudha Sharma, ma'am from Jammu. Ma'am, you are most welcome on this forum.
Thank you. Thank you, Dr. Trishla, for a sweet introduction. Very good evening, dear friends. And it's a freezing cold in Jammu, raining since morning. So a chilly evening from Jammu to everyone. Today's chief guest, Dr. Ambuja, I would call her today an educationist. Then eminent star speakers, Dr. Ragini and Dr. Padmini. Chairpersons, Dr. Reshmi, Dr. Amrita, moderator, Dr. Trishla, and our august audience. At the beginning, I really want to congratulate Dr. Lakshmi Srikhande, Chairperson IMS Education Committee, for organizing yet another event. And I wish you best for your tenure in ICOG. Topic chosen is very, very important, as everybody has said, though it was less spoken earlier in the past, but now it's being discussed more frequently, and that's the best thing about it. We all know sexuality's capacity for sexual feelings, thoughts, attractions, behaviors towards other people, and also describes person's sexual preferences and orientation. I think our speakers would throw more light on it. But I just want to, say one thing about a female's lifespan. Look at the irony of a female's life. At young age and adolescence, what do we tell them? We discuss how to control and suppress your sexual desires. Even female genital mutation is an example of it, which is a ritual still very common in the countries like Africa, Middle East, and Asia, which is a rite of passage into the adulthood and transforms girls into eligible wives. The other day I was reading about this Varis diary, who is the Somali model. And, she says that in this genital mutation, they cut your, clitoris, the labia, and they stitch the whole vagina, and they leave just a small hole for the excretions to flow. And when we grow old, we discuss how to bring it back all over again. So, but what I think is why we always discuss it at the time of perimenopause, menopause, and beyond. I'm sure you people must also have encountered, like me, that we have young females in reproductive age. They also come with, less desire for sex and sexual problems. So it's not always the hormones. What I feel is we have so many other factors, and we have the eminent faculty here to throw light on this subject. So we are waiting to hear more from them. Thank you so much for inviting me and making me a part of it. We wish a great success to this webinar. Thank you.
Thanks a lot, Dr. Sudha Sharma, ma'am, for addressing all of us on such an illustrative overview regarding midlife health. And hence, we are here today with our today's webinar on overview and case-based discussion on sexuality and beyond. It's my duty on behalf of Indian Menopause Society Education Committee to introduce and invite today's eminent chairperson. And our today's first chairperson is an enthusiastic and a vibrant chairperson who is consulting gynecologist at the H.D. Patel from Vadodara. She is into consultation more than 25 years. She was the past club coordinator for 35 plus, vice president of Menopause. So many awards and awardee in her credit. She works more on the adolescent health. She was been felicitated as well. She is the person who practices IVF and embryology as well. So I welcome Dr. Rashmi Banerjee ma'am as a chairperson to take your chair, as well the second chairperson. Likewise, the second chairperson is the sweetest and the gorgeous chairperson who doesn't, after seeing the slide, who doesn't need any introduction. But madam, you are the president, you are the.
Thank you, ma'am.
Thank
you, Dr. Trishla. Is okay.
Thank you. Thank you so much. And the platform is over to you, ma'am, and the forum is yours now.
Yeah. Thank you, Dr. Trishla, for the kind introduction. So I bring greetings from Baroda. Vadodara, it is actually known. It is a city of word, that is banyan trees in Gujarat. And also, you know, the place where Statue of Unity is there. And I'm also the organizing secretary for the current Vadodara IMSCon. And we are waiting to welcome you all to Vadodara when the IMSCon is rescheduled. So it gives me great honor and pleasure to introduce an eminent personality like Dr. Ragini Agarwal, all the way from Gurgaon. She is a fellow clinical gynec endoscopy from UK. She has done a master course in cosmetic gynecology and laser from Europe and American Academy of Aesthetic Medicine. She's a clinical director of OBGYN and Minimal Access Surgery, head department of cosmetic gynecology and pelvic reconstructive surgery at Pratiksha Hospital in Gurgaon. Additionally, she's also director of Dr. Ragini's Advanced Clinic of Women's Health. She's a vice president. She was vice president of Foxy 2020. She's a founder Gurgaon OBGYN Society, founder president Association of OBGYN of Haryana, founder president of and elect of Aesthetic and Regenerative Society India, and founder committee chairperson Aesthetic Health Indian Menopause Society, also president Indian Academy of. Ma'am, I really want to read out. It's an it's an honor to read the CV, as although the founder chairperson of IAG Haryana, founder president ISOPAP Gurugram, and founder president Haryana. So she's a founder president of so many associations, along with SOFSI, that is a Society of Vaginal Surgeons of India Haryana chapter. So we are really, it's a pleasure to see such pretty people on this webinar today, and looking forward to hear from you, Dr. Ragini ma'am. Over to you. I hand over the screen to you. Thank you.
Thank you so much, Dr. Rashmi. And thank you, Lakshmi, for giving me this opportunity to share the dais again with Ambuja madam, Sudhaji, and my favorite Dr. Padmani Prashant. And as Dr. Sudha has said, it's really a very chilly evening in Haryana also. And I'm sorry, this is my attire in whole winter. I'm always with one cap, so I can't come without it. You are all looking very pretty. So not.
You are also looking pretty, Ragini, even with the cap.
You are different.
So I'll just start and share my screen. And make it full. You just tell me, are you seeing the complete screen or half a screen?
No, not full screen.
Not full screen. Okay.
It's not in the slide share mode. It's not that.
Now full screen?
Yeah.
Okay. So I pay my gratitude to the person from where I have really taken many photographs and many points to make this article, from the articles to make this my slides. And gratitude to all who has helped me to be here, and with the blessing of Mahakal, I will start my presentation. So when we talk about the menopausal woman, and sex is something which is a absolute something anti thinking of a granny and thinking of the sex. When we are ourselves are the younger person. Even a 45-year-old woman we used to call Mataji in our OPDs. And today, to 45-year-old woman, we cannot even think of that she is going to be menopause. We have Club 35 plus, but today our girls are getting married at that age. And they are getting baby at that age, or at the 39, 40. So really, although God has not shifted the menopause, but as human being, we have shifted the appearance of menopause very much beyond the menopause. So this topic is very apt. Today, before 80, it's really very difficult to say anyone that you are an old woman. I'm not ready to become an old woman. Many of us, we are sitting here past 60, but still we feel young. So this topic is really, we have to discuss and understand. And as Lakshmi has said, we have to start putting in the practice also, not only discussion. Although Dr. Padmani is doing it for many years, many of us has started recently for few years, but this is the time when it should be discussed more and more. And women should also understand, being a 50, 60, she has not really become an old woman and sex has become absolute a taboo or something. No, but there are some practical problems also which she faces. So happiness can be found even in the darkest of the times if can only remember to turn on the light, and that light is education, understanding. Many women experience change in the sexual function during the years immediately before and after the menopause. And what are the common sexual complaints which they have? The most prominent is the loss of desire, decreased frequency of the sexual activity because of many, many reasons. It's not only one. Painful intercourse, yes. This comes with the menopause and beyond, with the lack of the estrogen, and this causes a painful intercourse, diminished sexual responsiveness, and we should never forget the sex is within two-person. Maybe it is a male partner. Many a time he is specifically in our Indian setting, is elder to the female also. So many times they also develop some problem, and this dysfunction of the male partner may be the main reason of this low desire. It is influenced by biologic and non-biologic factors. If you see this busy slide, why I have written this, everything, sexual arousal, including sensory perception, which is a very, very important thing when we talk about the arousal, central and peripheral nerve discharge, peripheral blood flow, and the capacity to develop muscle tension, as well as sexual desire and frequency of the sexual activity, can all be influenced by the ovarian hormone level. So what I have told you, the arousal, perception, nerve discharge, peripheral blood flow, congestion, body to bearing the tension, these are the part of the normal sexual cycle. When you are young, you cannot even think that activity of sex has so many things. But for an older woman having problems, sarcopenia, arthritis, is it possible to have all this to bear? No, sometimes it is really difficult. It is also influenced by the interplay of the psychological factors. These psychological factors, either of the end of your sexuality really matters. When you are understanding your sexuality, you are identifying what is your orientation, what is your gender identity, and how you feel about sex. Or on the other spectrum, when you become menopause, you have all other psychological problems built up inside you, which is not something like sexual abuse or something which we talk about the younger population. But here some other type of problems can arise. Loss of someone in the life, maybe the financial strain, which is too much for the many, many older women after retirement, family problems comes up, socio-cultural factors. It's a big thing in the ordinary middle class Indian population to talk about a granny, about sex and interpersonal factors. Yes, they do matter. We should remember the way our society is moving at the age of 45, 50, 60. Those women many a time standing alone. Their partner is leaving them for the younger population, and at that time they are not going to have another person, so they just hang on. They don't create any ruckus in the family. At least that man is with me. So these interpersonal factors, they're not going to discuss that person is having relationship with someone else. So these things we are not talking, we are putting in the closet, and these things has to come out when we talk about the sexuality in an older woman. Sexual functioning is a vital life quality. Sophisticated physicians no longer dismiss or ignore. Today it is legitimatized as a ISD. Number is also given. So patient can claim, mediclaim also, where the outdoor consultation can be claimed. So what are the factors we have to link to the sexuality? Importance. This is very, very important. Lack of sexual desire. Anxiety or uncertainty about the sexual orientation. Yes, many a time in the older couples also it come out, because in the younger time they are absorbed with the other things. But when they become older, the responsibility are reduced sometimes. They're really showing, I am really this gender identity crisis. We all today know about the LGBT community. Bisexuality is very, very common. Conflicting sexual desire between the partner. Many a time, husband is not interested. Loneliness, body image issue. Yes, your obesity, your wrinkles, they can give you a body image issue also. Then intimate problems. Intimate vaginal issue, laxity, prolapse, dyspareunia, the whole area is looks shrunken, and sexual impulses and compulsion that causes distress. Sometimes women think, oh my God, I still feeling to have sex, and it put a shame on her. So menopause affects sex drive. How? We all know the loss of estrogen and the testosterone following menopause can lead to changes in a woman's body and the sexual drive. Menopausal and the post-menopausal woman may notice that they are not as easily aroused and will lead to the interest in loss in sex. So basically, whenever we talk about the sexuality or sexuality disorders, here we cannot talk about the sexuality as we talk in the younger population about the gender identity or gender orientation, because most of the people by this time settle. Here what we are talking in the broader term is the low sexual desire, or a sexual desire which is not being totally completed by themselves or by the because of some reason they are not having to sex. So we always remember this chart of the 4 types of the female sexual disorder, although they are really flow in each other. And always remember this female sexual response cycle, which is must if you are one person is going to have sex. And from here arises these type of the sexual dysfunction. And in the woman, this is very, very important, the factor of the intimacy. Now I will discuss in short the endocrinology in the woman. When we talk about the endocrinology, the 2 spectrum, adolescent and the menopause, come here in the picture. When a woman attain the puberty, she has an anarchy. There's an increasing sex hair, libido, bone density, increasing stature, everything is increasing. And when she reaches to the menopausal senses, what happened? Everything goes down. See 2 things here, loss of muscle mass. That is very important when you need a sexual activity, and loss of the bone density. These two factors play a very big role. So these are other risk factors which can be arises, specifically lack of the privacy at this age. And lots of medication is entered in the life of the woman, which can cause and endometriosis and the atrophic vaginitis. So we have to see these factors. Psychiatric and neurological diseases come up with the age, and many a time the resultant increase in prolactin causing the gonadal suppression and affects the sexual function. Antipsychotic medication they lead to the increase in the prolactin level. Then multiple sclerosis, increase in the Parkinson disease with the age. Sensory dysfunction, the genital region is found in the many women with the multiple sclerosis. Then women on the anti-epileptic medication. Pelvic floor dysfunction, which increases with the age because of the childbirth, because of the childbirth trauma, fluctuating weight, obesity, and the loss of the hormones. Women develop prolapse, urinary leakage. So these all issues affect their sexual problems. Endometriosis leads to a deep dyspareunia. Uterine fibroids, you not operated because patient has never a problem. But that fibroid, that 3 centimeter of the fibroid, when it goes in the deep in the pelvis and it causes an obstruction, there is a narrow vagina already, there's an atrophic vaginitis. So it's very difficult to have already sex, and over and above there's a prolapsed ovary and the deep fibroid. So these things really matter. We think that patient has attained the menopause. This endometriosis, this uterine fibroid is not going to affect her. But those problem of the deep infiltrating endometriosis because of the fibrosis really exist. Then hypertension. And this hypertension may also be risk for the sexual dysfunction. Many a time the beta blocker have a detrimental effect. So medication and the substance effect we should remember. So now coming to what is the most important sexual dysfunction in the woman, it is found that the hypoactive sexual desire disorder is the #1 sexual dysfunction. Why we are talking today? Because post-menopausal population has grown like anything, and it was expected 1.2 billion post-menopausal women we will have in next future. There's an increased life expectancy, and we all have almost good 30 years beyond menopause or 20 years. And hysterectomy is one of the culprit. And please don't do hysterectomy of any woman unnecessary, even if you are operating at the age of 60. One ovarian carcinoma is going to the hell of a life to many women. So this oophorectomy itself is a big culprit when we do along with the hysterectomy to the older women. I still remember one of my patients. I operated her on at the age of 70 and did the oophorectomy, thinking I'm doing a very good thing. And her husband of the 75-year came to me and said, "Madam, किया क्या आपने ऐसा? पहले तो कभी-कभी हाथ लगवा लेती थी, अब तो हाथ छूने भी नहीं देती." So what is this? I will come in this ovary of a post-menopausal woman. And cancer in the early age giving another menopause to the woman. So data has shown that the age 60 or above, half of the women are sexually active and half are not. So who are not, they have their own problem. Who has, they have their own problem. Dyspareunia is common both in women older and younger than 65-year age, and lubrication is itself is a problem, or partner is another problem. And it was found that pre to the postmenopause or the perimenopausal transition to the menopause, it is a negative when you talk about the sexual health. Real negative are the responsibility, the frequency of the activity, tremendous libido decrease, and the dyspareunia. There's a survey which has shown that 10% have increased, but 37% has unchanged, but rest have a decrease in the sexual desire. So with or without estrogen therapy, there's a worsening of the libido, which means Although estrogen is improving vaginal health and the lubrication, there's a libido effect that they are not getting from the estrogen alone. Quality of life, it really impacted. It's not only a matter of the sexual exchange between partner, but physical satisfaction, emotional satisfaction, and the general health and the happiness also really depend on it. So why don't we take a sexual history properly? Either we are not trained, or we have a time constraint, or we are also shy to take it. It should become a part of a sexual history. Mostly attention is not paid to the human sexual dysfunction in our curriculum also. So when women also talk about it, we are not receptive. So women says in the survey that physician is not concerned. Until unless you seem concerned, they are not going to talk about it. This should be their older patient, or they are comfortable with you. So there should be a routine question like this. Do you have any sexual concern that you would like to discuss? Or women can have this type of in the perimenopausal era. Do you have also, the moment you generalize, a person can open with you. And specifically, it is your duty to ask your surgically menopausal woman, because you have given this menopause to her. So to establish a diagnosis of a hypoactive sexual desire, you have to see whether the patient is a persistent or recurrent deficiency, or absence of the sexual fantasy, or desire for receptivity to sexual activity. If no, then no desire disorder. If yes, then it is only a desire, because there should be no fantasy also. And it is a persistent, recurrent deficiency for a longer time. Then you have to go in deep and ask how long you have it. Is it always a problem, or recently it has arises to you? How is the problem affecting your life in day-to-day way? How it is affecting your relationship? Have you ever listened from anyone else also? So then you see there's a medical causes. Maybe the patient is having thyroid, metabolic causes, depression, any immunological disorder, specifically rheumatoid arthritis, which is increased a lot, fatigue from the medical disorders, or the androgen insufficiency, which is the most common reason in a normal older woman. What I am talking about, the oophorectomy, what it causes. So testosterone insufficiency is one of the major issues when low desire continued after the estrogen therapy and ruling out all medical conditions. It's not only a sexual issue, but also a well-being issue. Women who have a decrease in their testosterone level do not feel as well as women who have normal levels. I still remember when I was young in my village, the local doctor used to give the injection of the Deca-Duravirine to the older women. And they're so happy with one injection. For a month, they are very happy. Then they again go to the doctor and get one Deca-Duravirine. It is a testosterone injection. So see this algorithm, managing testosterone insufficiency, you have to ask the patient if patient is optimally estrogenized or no. If she is yes, patient has other symptom, no, then you think of the testosterone. So if patient has a complex sexual disorder, please refer that patient to Dr. Padman. We are all learning. So learn, it is must, because we have to treat our patient for the basics. But if patient has so many things to talk to you in brain, it is better to send that patient to the expert. And with the today's teleconsult, patient can take a consultation anywhere. So this deficiency of the androgen has a significant clinical manifestation. Now just see, what patient has a desire, then she has an arousal, and then she will have an orgasm. And this sexual desire, person should have a good health. So an older woman, until she has a good health, she does not have a sarcopenia, her bones are strong, her body is strong, her partner is good, she's not going to have a good sexual desire. Now, drugs that are very, very important. What type of drugs she is? Many times you have to stop those drugs and or modify those drugs, see the depression level in the partner, and the evaluation of the partner is also very, very important. And talk about a new life. In our country, we cannot talk about a new partner, but we can talk about a new life. What you want to be when you are young. If you ask me what I want to be, I always wanted to be a doctor. But if I don't want to be doctor, what I want to be? I wanted to be a chef. So today I am doing a lots of cooking. The cooking which I have never done, in the morning I do it, I enjoy it. First time I baked the cookies also 3 days back. And my 35-year son said me, Mom, you have never given me cookies when I was 5-year-old. Now you're sending these cookies to me. Whenever your mom is cooking now, she is an old woman, now she loves cooking. Now you become a young boy and eat it. So that it has given me a new life. So it is important for an older woman to have something in the life. Only then you can enjoy other things also. So this androgen production, which I am talking about, the oophorectomy, in the younger woman, a peripheral conversion is there. But in the older woman, there is no conversion and the peripheral conversion so much. What happened? The reticulus is almost finished. So there's no DHEA sulfate, no conversion. What happened in the menopausal is your ovary is the most important thing. It is ovarian androgen, which is producing lots of still androgen, not the estrogen. So if you remove an ovary, you are literally taking out all the androgen from that woman. So in menopause, when you have ovary, there's no longer ovulating, but being driven by the high levels of the LH, and there is a testosterone in the circulation from the post-menopausal ovary. So this androgen insufficiency lead to the decreased sex desire, diminished well-being, fatigue, depression. And women feel these things when she is 50s and the 60s. Diagnosis established by the symptoms. You don't require any test for it. There's a lots of emerging treatment strategies. For many papers are there which says that the rationale of the testosterone therapy is at this age because the testosterone level decreases after 40 years, and in women after oophorectomy drop 40 to 50 years associated with the sexual desire and the activity in the menopausal woman. Arousal and the proper sexual functioning is a vascular phenomena. So with the estrogen therapy, you need estrogen, not only testosterone. This estrogen will give a congestion and the vascularization of the tissue. Proper estrogenization is needed. Only then, if you give a little bit testosterone along with it, it will do a wonder. So the women with estradiol level less than the 50 picogram have higher percentage of the problems. In the another paper, it was presented when it was given methyl testosterone. Here what they found that these women with the low dose of the androgen had additional decrement of dose function, particularly when the androgen was administered in the low dose. So there's a lots and lots of a paper is there. This list is for basically for men. It is still not FDA approved to give you females, but if you see, it leads to increase orgasm, increase libido, increase enjoyment, increase satisfaction, increase pleasure, increase orgasm, increase activity, increase relevancy. I will not go in detail with these slides, but I can say there's a big study of different continent was done, and it was found there's a linear dose effect marginally significant when a patient is given placebo and the testosterone, and it was found along with the estrogen patch, it was found that patient was really benefited and there's no adverse effect like baldness or acne or maleness by male bias. So Not only this testosterone can be in a future way. Think of the bone mineral density, body composition, cognitive function, energy, and the well-being. But today, still, before giving, we have to talk to the patient. It is not allowed. It is the underlying thing, and we have first estrogenize the patient. Only then we can give this androgen therapy. So just to summarize, sexual complaints are reported to many women. Diagnosis of female sexual dysfunction is based upon the presence of the diagnostic criteria, is a clinical criteria, and it increases with the aging. Depression, anxiety, we know it's a part of the older age. Medications, many times we have to change it. Pelvic examination required. No test is required to conclude the woman's sexual health after menopause is gaining recognition. Low sexual desire often reduces women's quality of life. Given the substantial number of the menopausal women with the HSDD and increasing treatment option, greater efforts are needed to identify this disorder. Many factors, including declining androgen production influence, female sexual desire, and symptom of the androgen insufficiency include reduced well-being and the sexual desire and unexplained fatigue. Assessment of the symptom is essential to diagnosis of the hypoactive sexual desire, and maybe in future for something you need but not today, any laboratory test. I will finish my talk with this quote: there is no more creative force in the world than the menopausal woman with the jest, for which our Indian Menopause Society is dedicated. Thank you so much for your patient hearing. Thank you so much.
Thank you, ma'am. Hello.
Yeah.
Thank you, ma'am. Thank you for a great talk. You added new dimensions and new horizons to the sexuality and aging of the women. And you touched every part of it, even the endocrinological part, the importance of ovaries at the time of menopause, and everything. It was very well covered and a wonderful talk. It was really great indeed. And I thank Dr. Lakshmi Srikhande ma'am for making me a part of this great webinar. My respects to Ambuja ma'am and Sudha ma'am. Thank you so much.
Thank you, Amrita.
Thank you, Ragini ma'am.
Amrita, now you can introduce Dr. Padmini. विशाल, पद्मिनी मैडम का स्लाइड दिखा दो. रागिनी, मस्त था टॉक यार, मजा आ गया. So informative.
Yes, ma'am. Dr. Padmini is a great personality where the sex education and sexuality of women is concerned. She is the first qualified woman sexologist from Karnataka. She is the medical director of Ramamani Nursing Home and Maternity Home, and also the Institute of Sexual Medicine in Bengaluru. She is the president of Bengaluru Obs-Gynae Society and also the chairperson of Sexual Medicine and STD Committee of Karnataka Association of Obs-Gynae Society. She is also the member of World Association of Sexual Health and committee member of Sexuality Education and International Society of Sexual Medicine. She is the recipient of many medals and awards, the Silver Lamp Award, the Golden Lamp Award, and has authored many books. And she is often featured on many television and radio programs. And she is a faculty of many national and international webinars and conferences. So welcome, Dr. Padmini, on board, and nobody else can do justice to this webinar other than you. Welcome, ma'am.
Namaste to you all. A very good evening to you all. Thank you very much for this great opportunity to meet you all and participate in the discussion of a very important topic, and which is gaining so much of importance, and you are all giving so much of importance and then making this a great topic for discussion. I'm really very happy about it. Thank you very much for the kind introduction. And sorry, my throat may get, because I'm just recovering from COVID also, but somehow I prepared few slides. Okay, I'll share screen in the beginning. Okay. I really liked what Dr. Trishla said in the beginning, beauty of setting sun. It is not that the rising sun, but it is the beauty of setting sun. At that time, I really appreciated that. Okay.
Thank you very much, ma'am.
Yeah. And Dr. Ambuja also described so many of the cultural restraints which the woman has. Because most of the time, woman thinks that it is the end of menopause means end of sexual life also. So that cultural inhibitions and the mindset and what the society thinks, the negative attitude that has been there in the society is there in the every woman. And Dr. Sudha Sharma was describing the chilly evening. And if she understands her sexuality, and if there is a hot company, and that chilly evening can become a beautiful chilly evening. And so every aspect of it, right from the beginning, the causes and then the importance and the various types of all the dysfunctions were beautifully described by Dr. Ragini. And it was really nice to listen to her. I always tell her your content of your talk will always be very good and very informative. Thank you. Thank you all. Thank you, chairpersons. And moving on to my topic, only few slides just for a general introduction to understand when we discuss the dysfunctions and why it is caused and how we can go about it. Usually, as people think, it does not take so much of time. It is not time consuming. Once you understand the problems, the moment she tells everything. And if you make it a habit to take the sexual history for any type of gynecological problems when the woman comes to you. And the other thing is, before any surgery, before any treatment, or before any of these medications that you put in, during pregnancy, before pregnancy, after delivery, if you just make it a habit to talk to the couple, talk to the woman about the sexual dysfunction or sexual life, how they have to lead, when they can resume it. And if at all, if there is any problem for that, kindly come back and let me know. So if you just give the simple instructions, they show that you are very comfortable talking about the sexual matters, because it is a very important issue for everyone, and sexual health and function are important determinants of quality of life. So that's what I was telling. It was important determinants of quality of life. We always say sexuality of the youngsters is always glorified, and sexuality of the aged is ridiculed. So many times, so they will hesitantly, they will come and ask, my husband is so much interested, doctor. Is it okay if we continue sexual? No, why we should have at this age, isn't it, doctor? Because I have finished my family, we have got children, grandchildren, there are so many people in the house. When my husband shows interest, really, I feel very uncomfortable. He asked me to do so many things and cooperate with him, and I don't know whether it is right or wrong. That simple question is there in their mind. So if you acknowledge their sexual concerns and whatever, there is nothing like this is normal and that is abnormal, and you have to behave in this particular way or you have to behave in that particular way. Only this vaginal intercourse is normal. All the other activities are abnormal. There is nothing like that. Whatever that is accepted by the couple, and which is not causing harm to each other, and which is not against the interest of of one another. Certainly, any type of activity which the couple enjoys, that is normal. So that one has to understand, because so many times you yourself, doctors themselves will be having so many reservations. They themselves do not know what is right, what is wrong. And sometimes it may evoke so many strong reactions within your mind itself. So in all that conditions, only thing is you have to be very comfortable with the sexuality issues and never show your discomfort in front of the patient. Talk straight to her eyes, talk straight to her, and then whatever thing she asks, then you have to legitimize her concerns, legitimize her problems, and also legitimize whatever problem she has. Yes, it can happen to you. It can happen to anybody. And if you have this concern, then go ahead and give her suggestions, simple suggestions, simple telling, it is okay if you do like that. Madam, is it okay at this age if I masturbate? My husband died last year, and I am getting so much of desire in my mind. I just cannot remove it from my mind because I have never masturbated in my life. Is it okay if I masturbate? Will it cause any harm to my body? Will it cause any harm to my genitalia? So that is some question, concern. That's a simple concern for her, but that is a great problem for her. And if you say masturbation is not bad, masturbation is one way of satisfying, that is one way of sexual gratification, and definitely there is nothing wrong with that. You don't have to feel guilty about it. So anytime you have the sexual feelings, but don't make it a habit. So it should not become a compulsive masturbation, because that itself will become a psychiatric problem. Just a disclaimer, anytime once in a while do it and forget about it, and so that don't feel guilty about it. So that is how. So we should be always think, even when there are older people at home, because a single bedroom will be occupied by the youngsters and the son and the daughter-in-law, their family. But the older couple have to sleep with the children in the hall. Daytime, the house is full of people. Nighttime, they are with the children and others moving around in the hall. And so they will never have their privacy also. And they cannot just go out and stay in some hotel and be together and all that. So slowly, because of the lack of privacy, which Dr. Ragini was describing, that is a simple thing which happens. Then in that condition, you have to call the children and then tell them. So give them, they also need their privacy, their emotional satisfaction. So that is extremely important for them. So make time for them. Let them also have some privacy. Let them have their separate area, separate room, something like that. So when you are counseling, for a gynecologist, it is an advantage. So you get to see the whole family, not only the woman, the husband, and the whole family. So you will be understanding the psychology of the whole family. So you have got a right, and also you have got a privilege to describe everything to the family. And the sexual dysfunction is common, very common. All these things have been described. Certain things are only just maybe repetitions. I will not go through that. Obstetricians and gynecologists and primary care physicians are frequently the first line in the management of these difficulties. These healthcare providers usually have a pre-existing relationship with the woman and have established a pattern of visits and trust. So they should therefore take responsibility for the diagnosis and management of sexual dysfunction of menopausal women. These days, all the women are getting educated, they're having their concern, they want to enjoy, they have understood that they have got the sexual right, and they have got every right to experience, enjoy to the full extent and without hurting the partner. So that is their right. So when they come and ask about various dysfunctions, you should always be ready to help them. In whatever possible way, you help them. If you cannot help them, certainly you can refer to other specialists. So postmenopausal women have a feeling that it is embarrassing, uncomfortable, or a private matter. So they never open up. So though they know that it is an important component of their life, so many times the woman at 65, 70, when the husband are coming for some other reason, when the husband, and my husband is into, I am now nearing 70 doctors. My husband is 75-year-old. And even though he has got a lot of interest, till how long we can continue the sexual life? That is the commonest question people ask me. So then they say there is no age bar for the continuation of sexual life. As long as you have got interest, it can be continued as long as you're alive, as long as 80, 90, even 100 years. Because abroad, the people marry at 90 years. There are so many instances where even when the husband is having erectile dysfunction, they go in for the penile implant. They will have at that 90 years also, they still marry, they want that companionship. So there is no age for marriage. So the limitations. Now I am 50 or 40 years old and I am still unmarried, but somebody has shown interest in me to get married. Is it okay if I marry? Will my sex life, if he demands sex, what shall I do? Is it okay if then once I finish my periods, if I go into menopause, what to do? Afterwards, I will not be able to have sexual intercourse. No age is barred for that. See, sex or sexual relationship is not just about vaginal intercourse. So many activities, all the associated activities with the sexual interaction, part of sex. Even just to be close to your partner, just holding hands, hugging, kissing, and then even oral stimulation, all these things are part of sexual functioning. So the moment you say about sexual relationship or intercourse, they only think about vaginal intercourse, and that is not the only sex. So that has to be made clear to the patients. According to Masters and Johnson, one can continue sexual relationship and age is no bar as long as there is an interesting and an interested partner. So lifespan of an individual is increasing, as you all know, thanks to early detection of diseases and medical advances. So the population of senior citizens is also increasing. So we have to give them quality of life, especially when what is known as emptiness syndrome. When children are married, they go abroad for different reasons, and then the whole house is empty, only the couple is left behind. And they need all the more a good time, quality. Otherwise, how to spend the rest of, because 1/3 of their life they are spending post-menopausal. And that they have to have a good quality of life. Life has to be interesting, and they should have their company, good quality of life. So they also need the love, affection, and companionship. And sex is a binding factor for that. While the human body has some limits on the maximum age for reproduction, sexual activity can be performed or experienced well into the later years of life. So as I was describing it to you, it is not just about intercourse only. So many other activities like hugging, kissing, holding hands, mutual massaging, mutual masturbation are all part of sexual activities. These can give emotional satisfaction and good bonding. These activities can compensate even when there is difficulty or limitations for actual intercourse due to various diseases, low energy, joint problems, and other bone and joint problems. Still, they can have all these activities. And another thing one has to understand that if the couple is very happy with the simple sexual activities, and they're not having actual sexual intercourse, vaginal intercourse, and if they say when you're taking history, they say no, long back we have stopped, doctor, and it is nearly 5 years since we had our last intercourse. And then you should not jump and say, no, how is that? You can have intercourse, you have to continue. That is important. No, we are very happy without that. But if you go into the depth, they will be having all these other activities, which are giving them good bonding and the happiness and also the love affection, which they are showing to each other. Only both of them they're not interested to continue with the vaginal intercourse due to various reasons, either because of the husband's problem or the wife also has adjusted to that and she is not complaining. When she is not complaining, any definition of sexual dysfunction is that it should be causing distress either to the individual or to the partner. So if it is not causing distress and if they are not complaining, They are just happy with whatever they are. There is no need for you to force them for anything. So that is also one of the dictum when you are treating with sexual dysfunctions. So many believe that the menopause is the end of sexual life. It is a normal part of aging. Not aware. This is most important. The treatments are available. So they think so everything as a part of aging, it is happening. When there may not be any treatment, they are not at all aware that the treatments are available for this, so that they can have treatment for dyspareunia, treatment for various genital changes, treatment for the menopausal symptoms. So many women are not at all aware of this, not knowing how to talk to doctors. These are all various barriers which are existing to talk about the sexual matters. So any perimenopausal woman, if she comes, or when you are doing an operation and you are removing the ovaries, removing the uterus or the ovaries, so that is the time you have to sit with her and what problems they can have, and there are treatments available, and if they have got problem, they can definitely come and ask, and they can discuss with the husband, and they have to counsel the couple. That is most important. So the peri-postmenopausal sexual dysfunction, there is a disruption in physiological response, like as Dr. Ragini was describing, the changes in the muscles, smooth muscle relaxation, there are changes, vasocongestion. There is a problem with the the blood vessels, problem with the nerves, problem with the hormones, problem with the local musculature, all these things, and also about the vaginal pH and the environment which is there. So all these things put together. So we always will be blaming estrogen deficiency, estrogen, not necessarily it is estrogen deficiency. Various other factors also will be playing a part in that. There is an altered vaginal flora, decreased tissue elasticity, shortening and narrowing of the vaginal wall, which can cause painful intercourse, and decrease in sensory response. So the arousal can be delayed and there may not be sufficient lubrication response, and also the intensity of orgasm can vary in such condition because of the muscular weakness, pelvic floor muscles which have become weak. So these are all the other causes: decreased estrogen, androgen, aging, medication side effects, and the general, in addition to that, all the other, that's why we say biopsychosocial factors. All these things are playing a part in causing sexual dysfunction. And this also has been highlighted by Dr. Ragini Agarwal. Post-menopause, how the ovaries secrete the testosterone, and they secrete more testosterone than premenopausal ovaries. Premenopausal ovaries secrete about 25% of testosterone, whereas postmenopausal ovaries secrete 50% of the testosterone. But still, why are they having problem? Overall production of androgen is reduced due to decrease in adrenal production of DHEA and DHEA sulfate. So this is the one which is causing fatigue, decreased libido, decreased fantasies, and decreased arousal. But still, there is no well-defined normative data on testosterone or free testosterone content in the blood. And various medical conditions which can come in that age, thyroid deficiency, heart disease, diabetes, and antidepressants, antihypertensives which they are taking. So all these things can affect various stages of sexual response cycle. And so a simple 5-step method when you are treating this sexual dysfunction: identification of sexual health problem. When you talk to her and when she complains that there has been some problem, and the client and partner education, anything in the, when you are treating for any dysfunction, teach her the most important thing is about sexual health education that you are giving, and what is normal, what is abnormal. She acknowledge her problem and tell her this is the simple sexual response cycle. Some changes can happen because of the aging and certain changes. And if you are finding it difficult, or you think that if it is a problem, then that definitely there is a treatment for that. We can give you treatment. Client and partner education, modification of reversible causes. If you think the medication is causing problem, if you think just some reason for dyspareunia causing the problem, if the infections are causing the problem, these are all modifiable causes which can be corrected. And then the first line therapies, self-help materials, vaginal lubricants, moisturizers, psychosexual therapy, devices, and just hormonal therapies, wherever it is indicated. And then the second line therapies is the intensive treatment, and which can include surgical procedures or various rejuvenative procedures if the woman is interested. And there is recently one lady had come where she said she wants to get married at 50 years. And then, so because a long time back, she had lost her husband, and someone was willing with where the wife also had died because of the cancer, and they wanted to continue. And they wanted to know what all things that are available. So though she was perimenopausal age, whether the things can be corrected. And I'm because they go to net and read so many things, and this about rejuvenation, about this laser treatment, and there are so many treatments which are described. Is it available here, doctor? Botox injection, I heard. And so there are various, depending on the client's need and their capability or the affordability, or various options that are available can definitely be offered to them. So this is a multifactorial, and the diagnosis is complex and often difficult. But when you go on looking into these problems, it really, because it is not so complex, it is not very difficult to treat. And comprehensive evaluation, not that you have to do, you have to take each and every history like our postgraduate or the student takes, or do all the laboratory investigations, a battery of investigations, do all the tests. There is no need. Just a simple sexual response cycle. You take, have you got the desire? Any problem with the desire? Any problem with the lubrication or the arousal, the wet sensation which she feels with the sexual arousal? Whether there is any problem for the penetration, dyspareunia, or she is finding it difficult for penetration, or whether there is a difficulty in getting the orgasm. If you ask these four things, a desire, arousal, and a penetration problem, or an orgasm problem, so you can pinpoint where is the problem. And there is any local condition or a general condition or a medical condition or a relationship problem. So simplify, you can just bring it down to that. And depending on that, if you do simple examination, a simple pelvic examination can tell you a lot of things that you can utilize the pelvic examination both for diagnosing and as a therapeutic tool, where you can teach her and what we call it as body journey, how she can understand her parts and understand things. And so many times they have told, all these years I never knew so many things, doctor. No, and really we have missed so much in our younger days because we were not aware of these things, that this is even about their own genitalia, they are not aware. So look into the mirror, look and have a comfortable feeling about your own genitalia. And these are all the other things. Where is the pain and how to get over that? What is the problem? So it becomes extremely, it is very easy. It becomes easy to deal with a problem. So now is simple things, and all of us can discuss about these simple issues, because I could not prepare elaborate slides. Yeah. 1 minute. Okay, so I will just put these things, and you all can give your inputs, because these things you will be coming across in your. She is a 38-year-old lady which had come to me. She was suffering from severe endometriosis, and fortunately she had one child, and now it was an unbearable dyspareunia, and also it was a dysmenorrhea. And she was telling, as though every month I am having labor pain like pains. So I just want to get rid of it. So then both husbands agreed, and then the total hysterectomy with bilateral salpingo-oophorectomy had to be done for her. And she would naturally, you all know that she goes into sudden menopause. And so how do you go about it? So before doing the operation and after doing the operation, and what all things that can be done. we all can discuss. It is not that a great sexologist only has to treat these things. So this is that before doing the operation, and you can tell that these are the things after the operation, because there is the possibility of removing the ovaries, and this can lead to the sudden menopause, and there will be decrease in your hormone levels, and which can cause some changes. And depending on your interest in the sexual life, and because she is also young, husband is only 42-year-old. So the couple has to be counseled before that, and you can tell them, you can even after the operation, though we remove that, we can treat this and you can have your normal sexual life even after the operation. So that's to avoid this sudden menopause, then you have to put her on estrogen. Though we say that if there is no uterus, only estrogen is enough, but because it is a case of endometriosis, and any remnants should be suppressed, and so additional progesterone also is given. And when they start thereafter, 2 months after operation, when they start the sexual intercourse, give them the lubricants like lubric gel or KY jelly. Let them start with that, and then plenty of this what we call it as pleasuring exercises before they get into the arousal. So if they have got mutual body stimulation right from the head to toe, there are points what is known as erotic zones or erotic points where they can stimulate, explore your body. This is the time you can explore your body. Don't concentrate only on penovaginal intercourse, and you will not have if there is a proper arousal, and if there is a proper understanding of your body, and with good lubrication, certainly, then they feel very happy that they are normal. And after some time, they get used to that, and they may not need any lubricants even during intercourse. So that will continue. So this gives a lot of happiness to the patient. Another one, 52-year-old and menopause 3 years ago, she has come with severe hot flashes, perspiration, and then also complaining about decreased libido. And she did not know that, and I don't know of late, she was not knowing that this is, no, my wife is feeling very dull, and these days she is not at all taking part in any of these activities, and all the time she is dull. She'll be complaining, I'm not interested, I am not interested. And this is a very common thing that they say, even when it is so chilly, she wants the fan, full blasting fan. And so that because she was sweating so much. So then you definitely, there is no need to go in for any other thing with the history itself, you know that it is menopause. So because if there are systemic symptoms, naturally HRT may have to be started. And then with that only, if she is okay with her sexual relationship, there is no need for that. But so many times what they say is that even if you use HRT, for local strength of the vagina and the epithelium, so it is better to use local estrogen also for some time. Then, so that whatever that is there, and whether you can use it or indications, contraindications and all that, that any gynecologist can decide. But it is important to say, call the husband and tell that whenever he is complaining, now it is the time that it is a menopause and just a perimenopausal time. And these are all the common symptoms, and we can treat that. But only thing is, you should give her a lot of moral support, help her in the housework, give her more rest, more fluids, and then she also can give you good support and good companionship. So most of the time what happens, the wife is in menopause, husband, even especially if he is in a good government job, and I have seen quite a few ladies who complain that, so all these days he never came to the kitchen, never helped. I only had to bring up all my children, and then he does not know how to help me, how to do that. And even when I am suffering so much, he wants everything, a strict officer. And now I am so fed up, and he is interested in sexual life, and then now I am saying I am not interested. And because all these years, and he has bossed over me so much, he was doing so much of bossing and then ordering, and being very strict with me all the time, short tempered. So these things will be added to that. A disturbed interpersonal relationship or premenopausal, whatever sexual relationship they had, if they have had a good sex life, good sexual relationship, interpersonal relationship, that will automatically continue postmenopausal also. But in so many women, that may not happen because of the nature of the husband or whatever the way the interpersonal relationship has been there. So that is another one. And again, a menopause, and the husband comes and complains a lack of cooperation. And the husband says, so because I also treat men also for their dysfunction, so many times they come and tell. Then my wife says, no, everything is over and menopause, I have reached menopause. Why are you now interested? We have had the children, grandchildren. No, I cannot cooperate. I am not interested. But husband is very much interested in sexual relation. When he says, shows the interest, and she says, no, you can go and search some lady and then you can go and have it. So this is the attitude of so many ladies, even today, when they say their husbands are so disturbed and they go into depression and sometimes they develop extramarital relationship. So all these problems, a strong cultural influence is still there in our ladies. So that is how they do not. When I ask him, you bring your wife. No, doctor, she will never come to. And especially if I say this is for the reason of sexual problem, then all the more she will refuse to come. And it becomes very, very difficult how to treat such a couple. Husband, wife will never come to you. And so any opportunity to, if she comes for any gynec problem, so many times I tell them, don't tell that you have brought her for this sake. If she has got menopausal complaints or bleeding or any other problem, you just bring her to me. So that when I talk to her about the other problems, gynec problems, then I can slowly tell her or counsel her, if at all, if it is possible to change her mindset. So these are all some difficult cases, how when you are dealing practically with them. And this is another 50-year-old wife is interested. And though she is menopausal, she has been very much interested in the continuing the sexual life, and she has had a good enjoyment with the sexual life prior to her menopause also. But the husband, who is 58-year-old, and he is suffering from erectile dysfunction. And so he refuses to have, and he always gives excuses to her. And then, I'm not here. Today I got some work, and today I'm feeling sleepy. I have got headache, I have got toothache. These are all certain escapist attitude, how the husbands behave when they have got their own problem. So she is worried, and she has come for some other reason for the gynecologist. And she says, doctor, I am interested, but somehow my husband does not take it. Can you bring him to me? Can you come? No, doctor, if he knows that I must, I have told you about this, and then he will all the more, he will not come. Then he will start quarreling with me at home. If I say that, my husband is not interested. Slowly, when you really can bring the husband, talk to him, say that there, because many men do not know that there is treatment for erectile dysfunction, and a simple counseling and simple sildenafil treatment, and then teach the couple, so that gives them happiness, and the wife also will become happy. So there is a discard in so many cases where wife is interested, husband not interested, and the husband is interested, wife is not interested. And this is also the time when the husband will be developing so many sexual dysfunctions due to various reasons, maybe hypertension, diabetes, cardiac problems, joint problems, prostatic problems. All these things can give rise to erectile dysfunction or premature ejaculation. So slowly, wife also may start losing interest. And this is another very common scenario where the woman, then all the time she is refusing sexual relationship, because each time she has intercourse, she is having vaginal infection. So recurrent infections in diabetes is extremely common, and that is one of the reasons the wife can develop decreased libido, dyspareunia, and then she can painful intercourse and unable to reach proper orgasm also. and courses of treatment she will have received. And why still she is having this? Number one, a strict control of the diabetes and proper treatment of the infections, and give her a proper sexuality education. Even with diabetes, you can have a normal life. The infections have to be controlled, a proper genital hygiene, use the lubricants. And because what happens, they keep on applying some form of creams or ointments, and the whole skin gets sensitized. And then after some time, all these local creams will not have any effect, but will only sensitize the skin. And in addition to that, so many other skin conditions which can come in that age should be ruled out, because we keep on thinking that a diabetes, dyspareunia, yes, must be fungal infection. Treat her with antifungal treatment, and that's the end of it. And so courses after courses we'll be giving, but now stop all local medications. Only give some systemic medications for the infection, and then some soothing medication. And also then at the time of intercourse, use some lubricants. So that only that will help her to continue with the sexual relation. But so many times I have seen, though she has been having recurrent infection, husband is never treated. Because this, you all know that it is very important to treat the partner so that she doesn't get the infection back. And no, doctor, he refuses to take any medicine. What can I do? And I will be going on taking medications, and he is interested in sex. He will force me to have intercourse, but again I will start getting the infection. What to do that? So this is again, bring him and then talk to him. This is the problem, or at least ask him to use condoms so that the infection can be cut down. So this on some just simple practical points. So these practically what you are seeing in these conditions, it doesn't need too much of history, too much of theory, too much of investigations. A simple thing: give her education, tell her whatever that problem she has come, it is a genuine problem, she needs treatment. And if the husband is treat the relationship, that itself will go. A simple lubricants, moisturizers, local estrogen or systemic estrogen wherever it is needed. And this is another very important thing. In the perimenopausal, if they have the stress incontinence or urinary incontinence, because they feel embarrassed with that, no, doctor, nowadays I'm really I just don't know. Even after passing urine and then before intercourse, at that time I will have that some amount of urine leakage, and really that's why I have lost interest. But how to tell this to my husband? And whatever I am doing, I am not getting proper relieved of this problem. And to just tell you one article which I read recently in the Times of India, written by Dimple Khanna, not Twinkle Khanna. So nice article it was. Really, it was such an eye opener. So many ladies who are suffering from this urinary problem, incontinence, urgency, and they will not tell anybody. They think they will be silently suffering. They will not even tell to the doctor. We will not take any treatment. Post-delivery, post-operative, and simple Kegels exercise, post-delivery, if there's Kegels exercise, and then tell about these things. They can have urinary problems, stress incontinence, and so that they have to build up strength in their pelvic floor muscle. So many times these incontinence problems can be cleared. And even if they have got that problem, you should tell them that they have got a treatment for that. And this particular article, why it caught my attention is that she was describing one cabaret dancer, very chilly, cold night, and she was doing the dancing. And then in that cold weather, and she poured cold water on herself, and everyone were astonishing in such a cold weather, how she can drench herself with the cold water. Later, she told this lady, see, I'm suffering from this urgency and sometimes stress incontinence. I don't know how to, I feel very embarrassed if something happens there on the stage. So that's why this was the only thing suddenly which came to my mind. So I drenched myself. And that was such a pathetic thing when she is, how much pains she may be painful experience it must have been for her. So many ladies, see, these are the embarrassing moments which can happen to ladies. And so all these things need to be talked about when you are dealing with this perimenopausal woman. And dyspareunia and GSM, you all know, narrow vagina, fissures at porch, urinary frequency. But so many times husbands will be forcing them to have intercourse, and they come back with the infection and swelling and the tears. And you know that because not all husbands are very nice, and then they behave in a good manner, not hurting the wife. But I've seen so many types of husbands who are at any cost, they want to have intercourse, and they don't bother what happens to the woman. So woman herself has to take charge and take treatment to avoid all these problems. So dyspareunia and these conditions then build up the strength in the vaginal tissues. And the newer method, or if she can afford, then newer methods of vaginal rejuvenation can certainly be given to her. The option can be given. And about the Kegels exercises, lubricants, moisturizers, local estrogen treatment, all these things can initially, till the symptoms or till they get the strength in the vaginal urogenital tissues, every day daily, and then twice a week, later once a week once the symptoms settle. And just a local estrogen usually does not need to be given along with the progesterone, because it's very rare to have its effect on the endometrium. And this is another important issue which was raised by Dr. Ragini Agarwal in her slides, the cancer. Recently, I had one couple, not at 45, and she was around 30 years and love marriage, married for 6 months only. And then after that, she was detected to have this ovarian cancer, and everything was removed. And I had a phone call from the husband. Doctor, it is a love marriage. And now she was immediately after the marriage, she was detected to have the late stage cancer. And she has been having this, she was treated, and now everything, she has undergone radiotherapy, chemotherapy, all the treatments. I want, as long as she is alive, I want to give her a good life, whatever it is. Please guide me how I can go about having normal sexual interactions. So then I told her, bring your wife, counsel the couple. So it is not even after cancer, there is a life after cancer. So when she gets the cancer, that is not end of life. Whatever that is there, whatever any number of years you live, have a good quality of life. And you want to give her a good life, and really we should appreciate that. And then give her what all things she has been suffering from, and then local treatments, and also all these things, what we call it as Masters and Johnson's described, the pleasuring exercise, sensate focus exercise, and then exploring the body, enjoying their company, and even with the limitation. If anything is causing pain, change the positions. And some of these things with dyspareunia when they are, and sometimes the vulvodynia and dyspareunia, and if they can change the position of having intercourse, it is not that they should always have it, because so many ladies are, oh, you can have intercourse in other positions also. Is it okay? That's also, they're so astonished to listen to that. They can change the position. And sometimes the joint pain, severe joint pain, they cannot bend, they cannot sit. So in that case, even the husband may be suffering from a joint pain. So they can always change the position in a sitting position, side position, whatever that is comfortable. Because even some ladies, they're astonished to listen that there can be woman and top position they can use. If the husbands, I have got many husbands who have got severe backache, cannot have intercourse because of the back pain, and change the position which does not cause pain in the back, which does not put pressure on their knee joints, which will help them. So all these things can be, when you really talk to them, you can really explain to them all these things about the position, about the lubricants, about, so you don't need any big investigations, big treatments, simple treatments with like this, which is whatever that is available with us, and all the other treatments and some rare conditions where you can use testosterone patches, or with now, of course, this flibanserin and bremelanotide. All those things, though they are there for hypoactive desire disorders, not easily available in India, and there is no need for that. In certain cases, where to improve the vasculature, to improve the arousal, you can even use sildenafil tablets, vaginal tablets or oral tablets, though of course it is an off-label thing. You can use, like how they use it in infertility treatment to improve the circulation. You can use sildenafil tablets in some cases, and you can use sometimes the anti-anxiety drugs, and then the stimulators for if they are depressive. And so that if they really think they are suffering from depression, anxiety, you can take the help of the psychiatrist and then improve their mental condition, so that all those things also will help. So basically what gynecologists can do is about this thing. So when there is a cancer, when at 45, this particular case, when she came and told me, doctor, now I am completely all right. I have taken full treatment and I am willing to have the normal sexual relationship, but my husband is always irritated with me. And then he has already developed extramarital affair. So what to do with that? And then, so when I sat and talked to the husband, no, what is there? She is not a lady at all. When the uterus is gone, she is no more a woman. And what can I do with her? This is such an arrogant answer which the husband gave me. So to bring him back to that, and then we explain to him, tell him to improve the relationship. These are all little tough things. You may need 2-3 sessions to sit and talk to them, and slowly, so that you see, after all, she is a mother for your children, and you have to give a good life to children. If mother and father has got a good life, then that's what the directly or indirectly children will also learn that. And the children, what type of the lessons or education that you are going to give to your children. So in front of children, if you have good relationship, children also in their adult life, they learn to have good relationship. So all this, so many of these things, the general counseling becomes very important in difficult cases. Not that in each and every case, husband is very cooperative, the relationship is very good, because we'll only be talking about ideal condition. But in not each and every case, we will be having a woman is having an ideal situation. She will be having lot of problems. All those problems only a gynecologist can sit and listen to and give her a good life. So for the woman, you had to, my theme of my year as a president is speak the unspoken. That will gives health, happiness, and harmony for the woman. Thank you very much.
Thank you, Dr. Padmini ma'am. That was an excellent session. And I also truly believe that if a person can drive at the age of 80, if a doctor or a businessman can be a CEO or can lead a company at the age of 80, then why can't a woman and a man have sexual activity at the age of 80 and beyond?
Very well said. very
and
well
ma'am, what I loved about your talk today was that you emphasized to us gynecs that history taking is not very time consuming. Everybody feels that taking sexual history is very time consuming, but a few directed questions and the patient will just, like you say in the start speaking like a parrot, or when we say in Hindi ke popat ki tarah bolne lagegi. Just you ask them a couple of questions and she feels, she gets a vibe that the doctor is interested in her problems. Then she will just start speaking like a parrot and she'll come out with all her problems, and like in the movie Bagban, we saw that, the children tried to separate both their parents. So, the children counseling is also important. Partner counseling is also important. And ma'am, what was very nice, I loved about your talk was that you gave very simple, practical questions to ask to the patient, very simple, practical solutions or treatments to the problem, nothing complicated, nothing hi-fi, like so very simple practical things that we can, even in low resource settings, the gynae can help her patient. That's what I loved about this thing. And of course, partner treatment cannot be emphasized in any sort of infections. So now more and more of us gynecologists are aware about it. So syndromic approach, like both the partners should be treated. So really,
it's Dr. Padmini, it was excellent, really good. I am Dr. Sandhya Dikshit. I have joined through Ambuja Madam.
That's why the talk.
Thank you so much. Thank you.
Yeah, I am Dr. Sandhya Dikshit, and
sexual history,
it was excellent.
and solving
Madam's was excellent. The simple history taking, the simple remedies, giving an ear
like
to the distressed woman.
Talking to the Goliath.
It made a lot of difference.
Pardon, ma'am?
The simple history taking points, simple remedies, counseling.
I think, after years of practice, like right now I'm almost into the 26th year of my practice. I believe when, the patient, a newly married girl, had come to me talking of dyspareunia and vaginismus and vulvodynia, then she delivered with me, so the rapport that you build up with her during the antenatal care, if she delivers normally with you during your episiotomy suturing, goes on into her menopausal years,
Yes.
So we also grow up together along with the patients, and the growing up with your partner. With the partner is also, growing old with your partner is equally important, and more so in the after years, in the later years of life. So lovely talk, ma'am. We really have loved it.
That
and
we had a full circle. Right
it's a
from
whole
the time
circle
of
for all
birth.
of us.
Yeah,
Yes.
right
It's
from
a
the time
whole
of birth. Yeah, adolescent, premarital, marital, postmarital,
Yes.
till that. Yeah. So full circle will be.
And and then our, when we were young, the patient had come as a young girl, and then she brings her daughter-in-law, and probably, if you're old enough to continue practice, and the granddaughter, because she'll be having some adolescent problems.
I have delivered the 4th generation also.
Yeah, definitely. Like my teacher, so I'm associated with my teacher also. So we have the 3rd generation in the family coming in, so it is, it's a rapport that we build up with the patients, and they just, the history comes out with them, because of they know us, we know them since so many years, and they also know us also since so many years. So lovely talk, ma'am, and really enjoyed.
Padmini ma'am, your talk was excellent. Padmini ma'am, your talk is simply excellent.
Great talk, ma'am. Great talk.
And the simple remedies that you told are really, really, important for all the private practitioners.
I was really worried whether I'll be able to talk.
No, you talked very, very crisp and concise. And my only hope is that after listening to your talk, all the gynecologists in the audience, at least they should start taking that sexual history. I know many of the gynecologists are not comfortable. They themselves have that mind block, those prejudices, and they say, "Arey, ye to hamara kaam nahi hai, hum kyo puche? We will just treat her physical symptoms." So I only hope that everybody is sensitized enough that
we have
sexual health.
Open up our mind.
Sexual health is also gynecologist's responsibility. So अगर इतना भी समझ लिया तो I think आगे का तो हो जाएगा.
Like जैसे infertility में, simple thing, there are weekend couples, or there are fortnight couples. So the cause of infertility is they're not together during the period of ovulation. Just such a simple thing. So you have to explain to them that ovulation हमेशा Saturday, Sunday नहीं होता है, Monday, Tuesday को भी हो सकता है.
So that when you
and one more point, madam.
Sorry.
It is psychosomatic complaints that they come to us, simple aches, simple pains, some other small problem which is not there, and otherwise they are otherwise healthy, all vitals are normal, but what is underlying maybe some kind of psychosexual inhibitions or something like that. If we go and take the history, when they open up, probably these symptoms will go off, and she truly tells, pours her heart out, probably.
You're very correct. They don't know how to express it. So many times they don't know how to express it.
Right.
So that is how the psychosomatic.
Yes,
and she also spoke about infertility, because now we see that marrying at 40-45 years, and then part of it becomes infertility also. So in that condition, your counseling becomes all the more important.
Exactly.
Yeah.
And I think, ma'am, in a in the menopausal years, what happens during the reproductive years, I see many couples, they feel that, having intercourse is just to have a baby. So, they say, ma'am, ovulation period is over, then we may not have relations. But in menopausal years, the reason of having intercourse is not to have a baby. It's to bond with your partner, to feel the togetherness, the companionship. So I think that inhibition also, when it goes, it's more easy for them.
Correct.
So, during the reproductive, all my patients, ma'am, ovulation period is over. Now, is it okay if you don't have relations? But in menopause years, then this is not the fact. So the inhibitions are removed from their mind regarding this.
So just removing inhibitions is also a treatment.
Yeah, that's certainly just removing the inhibitions and making them comfortable with themselves and the bodies. It's going to make a great deal of help. Help them a lot.
Yes.
चलो अभी सुधा मैडम के कंक्लूडिंग रिमार्क्स तो मुझे चाहिए ही चाहिए.
Well, after hearing from such a
Thank you so much. I have thoroughly enjoyed this talk, Dr. Ragini's, and what Dr. Padmini has spoken. Wonderful. There's nothing for me to conclude, Dr. Lakshmi, because everybody put together, Dr. Reshmi and Dr. Sandhya and you, and I think everybody else, the inputs, they have been the concluding remarks. The only thing what I have gathered is that, basic counseling, psychosexual intervention, in addition to the medical evaluation, is very, very important. We have to look for their emotional and relational issues, as Dr. Padmini has said. So it's not always the hormones. It's not always the hormones. It's the other things equally important, which matters in a sexual life. What is your relationship with your partner? What are your liabilities? What are your professional problems? What are your, family problems, children problems? So I think all put together would make this problem more and more. So talk and talk and talk and talk and counsel and counsel and counsel and counsel. What I feel is more than 50% of treatment would be there. We need to tell them how this sex is important for your vaginal health. See, they do not know it. Believe me, as you said, Dr. Mohini, we also get to, see these kind of patients. Believe me, they say that, is it important? Is it to be done after menopause or during menopause or post-menopause? They really don't think that this is important. So you need to tell them that this is important for your vaginal health. As long as you are enjoying it, that is one part. Pleasure is one part. But medically also, if you keep having it, when they understand it, this vaginal health, I tell them that if you don't do it, you might get, vaginal narrowing and then UTI and all those things. Simply telling them that vagina and urinary tract is so much related with each other and how it helps in the health of vagina and urinary tract, believe me, they understand it. And then when they understand it, they will think over it. When they think over it, that thing comes, because it is not the hormones, it is the brain, it is the hypothalamus, it is that limbus, which is important, which gets stimulated and activated once you think about this. So we all have to tell them about these things. And one thing I always say that, I have seen few females enjoying sex more during this period, more during menopause, more during post-menopause, because no more fear of pregnancy, no periods, no pills, you are done with your family, responsibilities, your children are there. And if you have a good interpersonal relationship with your partner earlier, then they continue having sex. And I have seen patients in late 60s and 70s also having sex and enjoying sex. And they are very, very particular. Believe me, one of the female, she comes to me and she said that I have had a wonderful sexual life up till now in late 50s. And she said, now I am feeling little bit of vaginal dryness. What can I have? So this is the, questions they come from them once they keep enjoying. And whatever said and done, I have read few studies. They say that the male partner who are having sex in their older age also, it improves their health also, and longevity also. So it has been seen that it improves the health of a partner, male partner, and it gives longevity in few studies. So I always tell them that you keep fast as a karwa chauth for the longevity of your husbands. So why not do this thing wherein you are going to enjoy yourself? You will have a good vaginal and urinary health, and you will give enjoyment to your life partner, and the increased lifespan to your life partner also. So that is the crux. What I feel is counseling and talking to them is more important besides the medication, of course. Thank you so much for a wonderful thing. Thank you, Dr. Lakshmi, for bringing me in, and thank you everyone. And Dr. Everybody, Dr. Padmini and Dr. Ragini, everybody's talk was so impressive and so wonderful.
Yes.
And Dr. Reshmi's comments as well.
Thank you, Dr. Sudha ma'am. मुझे भी कुछ कहना है.
बोलो.
लक्ष्मी मैम कह सकती?
हाँ जी, बोलो.
सबने मना कर दिया, इससे ज्यादा नहीं कहने का. मुझे भी कुछ कहना है. Because our speakers are really the eminent star speakers of the national and international stature, as well the inputs of chairpersons were very helpful, and Sudha ma'am's kind and justified remarks on treating mind, body and relationship was too good. But dear all, you all know that we are at the concluding stage of webinar. I have ever learned to appreciate what we have right now with us today. And for that, giving me your hours and hours, which is a grace, and I feel gratifying in my heart every time. The fastest way to feel happy is to practice the gratitude. And thank you, Padmini ma'am, for well acknowledged my sentence. I, Dr. Trishna Dhimre, a sessions moderator, dutifully, which Dr. Lakshmi madam has given to me, dutifully would like to express my gratitude to all the esteemed faculties, right from our chief guest of honor, chairperson of education committee, sessions, renowned chairpersons, and the well-known speakers for devoting your time and gracing the webinar, as well spreading the knowledge amongst all. Thank you all. I further extend my gratitude to the respected delegates, colleagues, and friends all over for your gracious presence and contributing in attending and making this webinar a grand successful. Our wholehearted thanks to the pharma company, Walter Bushnell Healthcare Foundation, for all the technical support on the email as well the Zoom, and you had helped the Indian Menopause Society to make it a grand educational feast. Yes, it was a pleasure of mine to moderate the session where I could get everyone's support from everyone, so that I could articulate my part in front of you very well. And with the last sentences of the beauty of serenity of the setting sun, I just want to quote 3 lines. See, for it's everyone. The sun is setting down. The sun is setting down and the moods are awesome. We are all midlifers. May you all get the blossom. Yes. And once more, thank you with this quote for having the organizers such a knowledge and wonderful session. Thank you all with gratitude. Thank you.
Thank you, Trishla, for your wonderful moderation, and thank you one and all. Thank you.
Thank you.
Thank you, ma'am.
Thank you very much.
Thank you, ma'am. Thank you.
Thank you all. Thank you all.
Walter Bushnell always stands by you, persons kind of scientific piece, ma'am. It was really hearing from all, and it was very well conducted by Trisala ma'am and Padmini ma'am and Ragini ma'am and Lakshmi ma'am as usual. And Walter Butzen always stands committed by such kind of scientific feast, and it also helps us to take it to the next level in such kind of scientific seminars. Thank you. Have a lovely evening.
Thank you. Thank you,
Thank you.
Padmini ma'am. Wonderful.